So the next modality is computed tomography, CT, or CAT scan. So basically, this is X-ray plus, right? You can consider. So have the same imaging mechanism, but it's just you have multiple scans of the body. So this is 3D volume. X-ray typically we're referring to like a 2D image. Okay. So CT is a non-invasive diagnostic imaging procedure. Use a combination of X-rays and the computer technology to produce horizontal or axial images, often called slices. So yeah, so here we each of the we have 3D volume, right? So basically we can have multiple slices of the human body, right? So human body is also a 3D volume, so we can have different slices with different imaging content. So typically there is a narrow beam of X-ray is aimed at a patient and will quickly rotate around the body, right? So the patient will lie on the table, right? So this is the circle, or like you can call it like a donut, right? So you have these kind of X-ray gantries, right? You have these X-ray source to emit these beams at the human body and quickly rotating, and it will generate like a cross-sectional image or slices of the body, right? And these slices are called tomography images and will contain detailed information as the conventional X-ray, right? So here you can see there are multiple slices of the human brain, right? So the radiologist or doctors able to using these detailed volumetric data to identify or do some diagnosis. So with all X-rays, right, dense structure within the body, such as bones, are easily imaged, right? It will show bright white on the image. But soft tissues will, vary in their ability to, stop X-rays, will be difficult to see, right? So some of the soft tissues will may not be able to show very well in terms of different shades of gray. So in this case, to enhance the quality, right, or the contrast, so the intravenous contrast or IV agents will be given so that it will, some of the parts will be highly visible in X-ray or CT scan. And this IV contrast agent, can be are safe to use in patient. Otherwise, people wouldn't want to using this IV contrast, right? If it's going to be damage the human body. So the contrast agent will contain substance that are better at stopping X-rays. So in this case, will more visible on X-ray images. For example, to examine the circulatory system, a contrast agent based on the iodine is injected into the bloodstream to help illuminate blood vessels. Okay, so this type of test is used to look for possible obstructions in blood vessels, right? A clot, maybe. So this, including those in the heart. So, other than this kind of injection contrast, they can also be taken orally, right? So we can drink some of the, IV contrast agent, so that it can also enhance the visibility on the CT scan. So this is an example of the CT image, right? So on the left, so this is the abdomen image, right? Without using or taking the intravenous contrast, right? So if we look at this aorta, right? So the main artery of the heart, so it will show like non-bright region, right? If we take the IV contrast, so the aorta part will show very bright white on this image. Okay, so that's shows how important this can be for the IV contrast agent. And for the imaging, facilities or systems, right? We have different CT imaging system, right? So we have, C-arm, right? So basically, this is not a closed circle, right? So just like a C, like a half, right? The patient can be put under and take some of the images of the brain or maybe other parts. Okay, and mostly we have these like a donut-shaped CT machine, right? So patient lie on this table, will go going through this machine and take the examination. We also have some of the micro CT. So this case will used in maybe in industrial application, right? So for some of the product like metals, metal parts, or very precision, equipment, we have to carefully examine, right? If there are any defects on those products, we can using CT scans to tell, right, if there any potential defect on those products. Okay, so here I'm going to play a very short clip, basically kind of overview or summarize the CT imaging. Okay. Let's see if you can hear it.
A CT scan, also known as a CAT scan or computerized axial tomography, is a painless diagnostic test that uses X-rays and computers to create cross-sectional images of bones and tissues inside your body. Your doctor may recommend a CT scan to examine your body for any of the following: blood clots, broken bones, cancerous tumors, infections, internal injuries and bleeding, and signs of heart and vascular disease. A CT scan helps your doctor select the correct location for surgery, biopsy, or radiation therapy, check the treatment of cancer or heart disease, and check your condition after surgery. A CT scanner is a large square or round X-ray machine with a tunnel through the center. During your CT scan, you will lie on a table that slowly passes through the tunnel. As you move through the tunnel, a giant ring called a gantry will rotate around your body. The gantry contains a tube that will release X-ray beams and detectors that will measure the amount of radiation absorbed by your body. The X-ray beams will capture many views of your body from different angles as the gantry spins. The detectors will send data to a computer that will create cross-sectional images of the bones and soft tissues inside your body. The scan allows your doctor to see the location of a condition inside your body, which will help them decide how to treat it or to see how well your treatment is progressing. In some cases, you may receive contrast dye before your procedure in a drink, an injection, or a barium enema to make it easier for your doctor to see certain areas of your body. If you received a drink with contrast dye, your esophagus or stomach will be highlighted. If you received an injection, your blood vessels, gallbladder, liver, or urinary tract will be highlighted. If you received a barium enema, your large intestine will be highlighted. After the procedure, you can resume your normal activities. If you received contrast dye, drink plenty of fluids to help your kidneys remove the dye from your body.
Okay, so that's a very good summary about this CT imaging. And here I actually have another short clip showing how the CT scanner actually spin at the full speed. Let's take a look. So actually you can see the sketch can rotate very quickly. Okay. So yeah, so I think you guys get an idea, right? So how this internal mechanism of these CT scanner works. And because of the nature of the CT is the 3D volume of the image, right? So we'll have different cross sections of the human body, right? So we have different views, right? So we have axial view, sagittal view, and coronal view. So here's some of the basic definition, right? Like these 3D view terminologies, right? So we have a couple of directions, right? We have left and right, and we have front and back, or we have anterior or posterior, and top bottom, right? So we have a superior or inferior. Okay. So for the sagittal view, so basically you have this sagittal plane, right? You're basically looking at the left and right. Okay. So you can imagine, right? So we have this cross section of left and right. And for the coronal view, right? So basically anterior and posterior, right? Front and back. And we have the axial view, right? Superior and inferior, right? And top down. Okay. So these are the different views or planes that we can view the human body. So because of the 3D nature of the CT image, right? So we have multiple slices. So if we are indicating image, right, using IXYZ, right? IXYZ indicating the pixel or intensity value, will have, in a 3D space, right? We'll have the pixel location of X and Y and Z. Okay. So basically this is the important thing we have to remember, right? So the CT is a 3D volumetric data. Okay. And there's a lot of applications for CT imaging, right? So first we can do the tumor detection, right? So this is the CT liver tumor segmentation, right? So these are the two different colors indicating two classes, right? The red region denote the liver, and the green region denote the tumor. Okay, so we can using machine learning or computer vision algorithm to detect the liver and also segment out the tumor region. And we can also using CT imaging to examine different lung conditions or diseases. So these are different conditions or disease of the lung, right? So so I think these images are very clear for radiologists to make all the diagnosis.